Welcome back. On Tuesdays, we like to focus on parenting and education issues, and right now we are going to turn our attention to newborn health. There have been some new developments and research done about gut health within newborns and some treatments. I recently spoke with Dr. Tanya Altmann. She told me all about this.
As new parents, the last thing we want to do is miss an essential, vital step, especially when it comes to protecting our little ones. But as we recently published, peer-reviewed study shows, even with the best preparation, more than 90% of the babies in the U.S. suffer from newborn gut deficiency, a hidden problem linked to an increased risk of developing colic, eczema, diaper rash, and even type 1 diabetes. Author and child health expert Dr. Tanya Altmann is here with details and advice for parents and parents-to-be. Dr. Altmann, thanks for joining us.
Thank you for having me.
So what is newborn gut deficiency, and how did this study uncover what babies are suffering from that we might not have been aware of?
So a recent study published in Scientific Reports showed that across the United States, more than 90% of babies are missing the key good gut bacteria called B. infantis EBC001. And when this bacteria is lacking, it causes something called newborn gut deficiency, because B. infantis is the critical good bacteria that babies need in the first 6 months of life. It's actually what helps program their immune system. And so when you don't have enough of this good gut bacteria, you can get an overgrowth of bad gut bacteria. And this is what causes short-term health conditions in babies, such as colic and diaper rash, but more importantly, long-term health conditions, such as allergies, asthma, and type 1 diabetes. In fact, there's a large international study going on right now working on the role of B. infantis EBC001 in preventing type 1 diabetes in children.
What are the signs that a baby might be having issues linked to newborn gut deficiency, and what can you do about it?
So as a pediatrician, I see babies every day in my practice, and signs that I look for that something is going on and isn't quite right with their gut microbiome is if they're just too fussy, too colicky, too gassy, if they're having increased diaper rashes, skin rashes such as eczema, or if they're having a lot of watery stools a day, usually more than 5. To me, that's a sign that they don't have enough good gut bacteria and that they're having overgrowth of bad gut bacteria. So in my practice, what I do is I actually supplement them with the important critical good gut bacteria called B. infantis EBC001, also known as Avivo. And I have the parents mix this with breast milk and feed it to their baby every day. And clinical studies show that by feeding babies Avivo every day, you can reduce the bad gut bacteria by 80%.
And what can parents of newborns do to ensure a healthy gut for their baby?
So I think this is really important because as a parent, you see your baby there laughing, smiling, cooing at you, but you can't look inside, right, and really see their gut microbiome. So you have to sort of think about everything. So in addition to talking to your pediatrician about taking probiotics, EBC001, Avivo every day, you want to make sure that you're breastfeeding, that when you do start solid food around 6 months of age, that you feed your baby plenty of fresh fruits, vegetables, and whole grains, as these are the foods that really feed that good gut bacteria to ensure that your baby keeps that healthy gut microbiome for the rest of their life. In addition, spending time with your baby is so important. So make sure that you read to your baby, talk to your baby, get down on the floor and play with your baby, and just enjoy every moment as the time goes by so quickly.
And what other advice do you have for new parents?
So I would say, as a new parent, stay in touch with your pediatrician. They are really the person that you want to call when you have questions, especially in the middle of the night. So if something doesn't seem right to you, trust your gut. You know your baby better than anyone else. So anything that's off, ask your pediatrician for advice. And then also, as we mentioned before, just really enjoy the time. I know it's hard with sleepless nights and the feeding around the clock initially, but every day does get better and babies grow up so quickly. So try to enjoy every moment before it passes you.
So true. It does go too fast. Where can we get more information?
So for more information, visit avivo.com.
Will do. Well, thank you so much, Dr. Tanya Altmann, for joining us here on Park City Television today and helping us keep our newborns healthy and strong.
Thank you for having me.